facial plastic and reconstructive surgeon. You can find me at knows-about-face.com. Today we're going to talk about the preparation for surgery or procedures and all of the events that might be important. And I'll start by the early events and go through the day of surgery and afterwards. So the early preparation, sometime prior to 2 weeks or so, that's when we do a history and physical, and we make sure someone's fit and healthy and safe for the surgery. That would involve disclosing medications and make sure there are no curveballs that we have to figure out in preparation. I think it's also important to arrange nursing care if that might be helpful after the surgery, and manage, of course, the time with your work and all the family leave type paperwork that we can help you with. At around 1 week prior to the surgery, or 1 to 2 weeks prior to the surgery, it's also important to consider what medications or supplements that might increase the risk of bleeding. So we advocate people coming off of aspirin and vitamin E and all the omega fatty acid products at around that time. Keep a healthy diet. There are other softer things you might do like arnica montana or bromelain. Those are less important to me, though I support the use of them if you favor that kind of approach. The night before the surgery, relax. I want you to get a good night's sleep. The nil by mouth or NPO status will be important. Most surgery centers or procedure centers, hospitals, will advocate nil by mouth from midnight the night before. That can be hard, especially if your surgery is later the next day. What counts, at least where I work, is avoiding solid foods, which would also include milk products, 8 hours before a surgery and 6 hours before the surgery for clear liquids. But do pay attention to that, because it might mean you could have an early breakfast or coffee or whatever. On the day of surgery, I want you, again, take a deep breath and relax. We do this all the time. But on the day of surgery, I'd advocate taking all of your normal medicines with just a sip of water. Diabetic management is slightly different, and that might be discussed more on a case-by-case basis, there being so many different needs. I do advocate the use of chlorhexidine baths, especially if there's a history of MRSA or MRSA exposure. It's not an essential thing, since we will prep or clean the skin prior to any procedure, but it's an extra if you are the thorough type. Immediately after the surgery, it's ice and elevation. We want to take care of pain and nausea, and definitely you'll be with us until those issues are managed if you're unlucky to suffer those problems. We give medications usually before or on the day of surgery, and it's in a different conversation that I go into that detail. We do advance liquids first, and if your stomach's tolerating liquids, we then have you move on to solids with time. Just take it easy. The day after surgery, again, start your normal routine, start your normal diet, start your normal medications. Wound care, again, is important here, ice and elevation. For the coming days or weeks, for most surgeries that I will do, wound care will involve ointment on the wound site itself. We do advocate an antibiotic ointment for no longer than 3 days, there being such a high incidence of allergies at day 4. More and more the dermatologists are just pressing for plain Vaseline or petrolatum products. And so you could either start from the beginning with a petrolatum product, or say on day 4, start with that. And then we'd advocate using that as a sealant or waterproofer, even before bathing, for approximately 7 to 10 days, or at least when the stitches come out and the skin is healed and sealed. The more distant wound care might involve bandages and wraps, and these might be covered better on a case-by-case basis. I hope this is a good primer in preparation for your big day. And thank you for listening.